This conference will now be recorded.
So today we will see methyl alcohol. So ethyl alcohol is very important both in practical aspect. So you have one practical 7 marks exercise for writing uh, mm, alcohol intoxication patient, how to write a medical legal report in a patient who consumed alcohol. This is about methyl alcohol, and methyl alcohol, is other name is methanol. It is also called as wood alcohol. It is also called as wood naphtha. It's also called colonial spirit and wood alcohol because it is a byproduct in the destructive distillation of wood. So because it is as a byproduct of distillation of wood, so it is known as wood alcohol. So it is bitter in taste, and then it is clear, colorless, volatile liquid with odor and a bitter taste. What are the uses of this methyl alcohol? Methyl alcohol is used as an antifreeze agent. It is used in a denatured spirit. It is used in leather dyes, washing of windshields, and then embalming fluid. What is the fatal dose? Fatal dose is 70 to 100 ml. So this is the mechanism of action of methyl alcohol. So methanol or methyl alcohol is converted into formaldehyde in the presence of alcohol dehydrogenase, and then this formaldehyde is converted into formic acid in the presence of formaldehyde dehydrogenase. So this formic acid is the main culprit which causes the tissue injury and the metabolic action of methyl alcohol. So whenever this formic acid again is metabolized quickly into carbon dioxide and water. So our main aim is in prevention of this methyl alcohol poisoning is to decrease the formation of this formic acid. If the formic acid is not formed, then there are no ill effects of this methanol or methyl alcohol. So mechanism of action very important. Methanol is converted into formaldehyde in the presence of alcohol dehydrogenase, and then this formaldehyde is converted into formic acid by formaldehyde dehydrogenase. So there are two enzymes, alcohol dehydrogenase and formaldehyde dehydrogenase. Two byproducts, formaldehyde and formic acid. So what are the clinical features? Clinical features, um, there will be symptoms which develop within 12 to 24 hours, which we call as earliest manifestations. The earliest manifestations are nausea, vomiting, pain abdomen, vertigo, headache with stiffness of the neck, which we call it as meningismus. Meningismus, which is nothing but headache with stiff neck. Meningismus is the earliest feature of methyl alcohol poisoning. And later, we have ocular toxicity due to the action of formic acid on the optic nerve. So the patient will experience blurred vision. There can be photophobia, means he cannot tolerate excessive light. There is visual field impairment, rapidly progressing to blindness if no immediate treatment is given. So ocular toxicity is mostly because of the formic acid action on the optic nerve. And then it is a late feature. The clinical features are blurred vision, photophobia, visual field defects, and then it can lead to blindness if not treated. So, and then you need to have an ophthalmologic examination on a dilated pupil, which has a sluggish light reaction. So, whenever you take him to an ophthalmologist, the pupils will be dilated, and then they have very sluggish reaction to the light. And the fundoscopy shows hyperemia of the optic disc and retinal edema. So retinal edema, optic disc hyperemia, dilated pupil, sluggish light reaction, blurred vision, photophobia, visual impairment, and which can lead to blindness. These are all the ocular symptoms and toxicity caused as a late feature due to the action of formic acid on optic nerve. These are the other features, severe features. There can be high anion gap metabolic acidosis. So we are not dealing with what is the anion gap metabolic acidosis. You might have learned in biochemistry. So high anion gap metabolic acidosis is one of the main feature of methyl alcohol poisoning, and along with there can be tachycardia, hypotension, and hypothermia, convulsions and coma can be there, and death is due to respiratory failure. Death is due to respiratory failure, and mostly it is resulting from high anion gap metabolic acidosis. High anion gap metabolic acidosis. So how to diagnose methyl alcohol poisoning? Well, one feature is high anion gap metabolic acidosis, and then by measuring the blood methanol levels, which if it is greater than 50 milligrams per deciliter, then we can diagnose the methyl alcohol poisoning. So two features: the blood methanol level greater than 50 milligrams per dl, and then high anion gap acidosis. So how do you treat a patient with methyl alcohol poisoning? So normal routine washing, stomach wash with sodium bicarbonate solution. And then what is an antidote of methyl alcohol poisoning is ethyl alcohol. Antidote for methyl alcohol is ethyl alcohol. Antidote for methanol is ethanol. So ethanol is specific antidote. What does this ethanol will do? This ethanol will bind to alcohol dehydrogenase and then prevent the metabolism of methanol into formaldehyde. We have seen in the previous slide where in the metabolism mechanism of action, the methanol is converted into formaldehyde and then formaldehyde is converted into formic acid. The methanol is converted into formaldehyde in the presence of alcohol dehydrogenase, and then the formaldehyde is converted into formic acid in the presence of aldehyde dehydrogenase or formaldehyde dehydrogenase. So ethanol will bind to the alcohol dehydrogenase, preventing the conversion of methanol into formaldehyde. So the route of administration of ethanol is IV or oral route. So dosage in IV route is we have to give 10% ethanol at a dose of 10 ml per kg over 30 minutes, and this is followed by 1.5 ml per kg per hour as to produce blood ethanol levels of 100 milligrams per 100 ml. So the main aim of giving this IV is so that the blood alcohol levels will be about 100 mg per 100 ml. So we will give 10% ethanol at a dose of 10 ml per kg over 30 minutes, followed by 1.5 ml per kg per hour. Suppose if you want to give oral, then you have to give 1 ml per kg of the 95% ethanol in fruit juices over 30 minutes. So, and then for maintenance dose, we can give about 0.17 to 0.25 or 28 ml per kg of 50% ethanol. So whatever it is, so in case of IV, we give 10% ethanol. In case of oral, we give as 95% ethanol in a dose of 1 ml per kg body weight in a fruit juice over 30 minutes time. And then the third one is another antidote and new antidote that was introduced is fomepizole. Fomepizole. Fomepizole it also inhibits alcohol dehydrogenase enzyme, and it does not cause CNS depression like ethanol. So the problem with ethanol is again it causes CNS depression. So in order to prevent this, we have a new drug called fomepizole. which has the same mechanism of action as ethanol, which inhibits alcohol dehydrogenase. And then we have sodium bicarbonate, which is given IV, about 500 to 800 ml of 7.5% solution, which is given slowly. And then we have folinic acid, given IV, about 1 to 2 milligrams per kg, given 6th hourly, which accelerates elimination of formic acid. So folinic acid IV is given to increase the excretion of formic acid, given in a dose of 1 to 2 milligrams per kg 6th hourly. And then if the patient is in a comatose patient and not high doses of methyl alcohol poisoning is there, then we have to go for hemodialysis. Very effective in removing methanol, formaldehyde, and formic acid. So all the three can be easily removed. So grossly, we give stomach wash, ethanol, which is the specific antidote for methyl alcohol poisoning, and then it can be given IV or oral, and then it can be given. So for IV, we use 10% ethanol. For oral, we use 95% ethanol. Another antidote is fomepizole, which has the same mechanism of action of blocking alcohol dehydrogenase, thereby preventing the conversion of methanol into formaldehyde. And then we can give sodium bicarbonate in order to decrease the anion gap acidosis. So there is acidosis, metabolic acidosis. So in order to prevent in order to compensate or treat the metabolic acidosis, we need to give sodium bicarbonate. And then folinic acid is given IV in order to increase the excretion of formic acid. And then hemodialysis, which is used for removing all the three products, methanol, formaldehyde, and then formic acid. What are the autopsy findings? You can see cyanosis because of the acidosis, very prominent, especially in the upper parts of the body. And the liver, kidney shows some toxic damage, and then there can be congestion. Lungs are edematous, along with routine viscera. Cerebral hemispheres are also clear. So in alcohol, one organ that was preserved apart from the routine viscera is brain. So cerebral hemispheres are to be preserved in any case of alcohol poisoning, in a case of autopsy. So autopsy findings are not very much specific. There are only a few features like cyanosis, that it can be congestion, there can be edematous changes in the brain. Congestion can be seen in the organs. So not much of specific findings are found in autopsy. What is the significance, medical legal importance? So mostly methyl alcohol poisoning is an accidental poisoning. Sometimes it can be homicidal poisoning, where the people can mix this methyl alcohol in ethanol, in normal alcohol, and then make the other person to drink this contaminated alcohol. Due to adulteration of ethanol with methanol, result in mass deaths, also called as liquor tragedies or huge tragedies. Huge tragedies came into light in 2009, where that occurred in Gujarat, that has killed about 130 people because of this adulteration or contamination of ethanol with methanol, which leads to the death of about 130 lives. So this is known as huge tragedy or liquor tragedies. So mostly methanol poisoning is accidental. Sometimes it can be homicidal. Ethylene glycol poisoning. So just a note about this ethylene glycol. It is used as an antifreeze, radiator, coolant in vehicles. So ethylene glycol is used as an antifreeze, radiator, coolant in vehicles, in hydraulic brake fluids. And also it can be used. The fatal dose is about 70 to 100 ml, and the mechanism of action is where the metabolites are converted. This ethylene glycol contains metabolized into glycoaldehyde, glycolic acid, and oxalic acid, which inhibits diverse metabolic pathways. So ethylene glycol on metabolism, it will convert it into these three metabolites: glycoaldehyde, glycolic acid, and oxalic acid, which has various inhibitory action on different metabolic pathways. So clinical features, there are three stages. One is CNS stage, CVS stage, and renal stage. The first stage, the second stage, the third stage. The first stage is the CNS stage, which is up to 12 hours. The patient will have ataxia, inebriation, convulsions, and coma. And then the second phase, which is at the CVS stage, the time is about 12 to 24 hours. The patient will experience the tachycardia, tachypnea, and then circulatory collapse. And then the third stage, which is the renal stage, which occurs about 24 to 72 hours, where the patient will have symptoms of oliguria, tubular necrosis, calcium oxalate crystals in urine, and then he will finally land in renal failure. So three stages in ethylene glycol poisoning: CNS stage, CVS stage, and renal stage. What is the diagnosis? Diagnosis is by high anion gap metabolic acidosis, and then we can have calcium oxalate crystals in urine. What is the treatment? Stomach wash with activated charcoal. Here also the antidote is ethanol. Famipizole can be used. Hemodialysis is also one of the modality of the treatment to eliminate the metabolic products, and sodium bicarbonate to decrease the metabolic acidosis, and calcium gluconate 10% to counteract hypocalcemia. So both methyl alcohol poisoning and ethylene glycol poisoning, almost the treatment aspect is the same, only the symptomatology will differ. The symptomatology here we have three stages: CNS stage, CVS stage, and then renal stage. Autopsy findings, there can be cerebral edema, there is damages of liver and kidney, and then oxalate crystals can be found mostly in kidneys, but sometimes it can also be found in brain and spinal cord. The pharmacological importance is it is also an accidental poisoning, especially in children, due to its sweetish taste. So ethylene glycol poisoning, it is used as a coolant in radiators in vehicles. So because of the sweetish taste, it is taken by the children as an accidental poison. Next CNS depressant is opium. Opium is very important. Uh, Opium comes under somniferous drugs. What are these somniferous drugs? Somniferous means sleep inducing, the drugs which induce sleep, which is exactly what narcosis means. So the narcosis also, that's why we call it the narcotic drugs. Narcotic means sleep inducing. So any drug which induces sleep, we call it as narcotic drug. So the same is for somniferous also. So somniferous means sleeping inducing, which is exactly what narcosis means. Somniferous drug also referred as narcotics. Quite essential narcotic is opium. Quite essential narcotic means a prototype drug. The prototype drug for a narcotic drug is opium. So narcotics. So what are these narcotics? So this is defined according to the United Nations Convention. So narcotics are substances and preparations that induce drowsiness, sleep, stupor, insensibility, etc. So these are the substances mainly which induce drowsiness and sleep, which induce sleep. So substances or preparations that induce drowsiness, sleep, stupor, insensibility are known as narcotics. Medically, they are used as a potent painkillers, cough suppressants, as anesthesia, as active components of antidiarrheal preparations. So most of the cough syrups contain some narcotics in there. That's why if the cough syrup is taken normally in children, they will sleep a lot because of this presence of narcotic presence. So they're cough suppressants, cough depressants, they're potent painkillers. They're used as an anesthesia, and then they're also used in the antidiarrheal preparations. Where is this opium is derived from? Opium is derived from dried latex obtained from uh, poppy plants. Uh, they are having a somniferous, Pepivarums somniferous plant. So opium is derived from the latex obtained from this poppy plant. So they are obtained from unripe seeds, unripe immature seeds. We call the pods, which we called as fruits, by hand, and then they will be streaking them. The latex leaks out and dries to a sticky yellow residue that is later scraped off and then dehydrated. So I will show you the picture of the unripe fruit. So what they will do is they will take this unripe fruit and then they will streak this on the lateral side of this fruit, so that uh, some white sticky material and yellowish residue will come, which is known as latex, and then this latex is dried, and whenever it is dried it will taken off and then it is dehydrated and it is used as a opium. And the raw opium has a characteristic odor which is strong and pungent, and then this opium contains two alkaloids. One is morphine, codeine, and thebaine. There is one type of alkaloid called phenanthrines, and then another is papaverine and narcotin, which is isoquinoline. So no need to remember about these phenanthrines and isoquinolines. You can remember the name of the alkaloids. Morphine are active principle. Morphine, codeine, and then thebaine, and then papaverine, narcotin. Morphine, codeine, thebaine, papaverine, and narcotin. So morphine is more in quantity in opium. So poppy seeds, which we called as cuscus, are also used in routine preparations of food, and also the oil is also used, which is nutritious and it is not poisonous. So this is the poppy plants, and then this is the right side poppy fruit, unripe fruit. You can see there are linear markings which is done so that the latex will come and then it will dry off, and then this dried off latex is taken, and it is nothing but the opium, which contains the morphine, thebaine, papaverine, all these compounds which will induce when taken, which will induce sleep and drowsiness. So this is the unripe fruit of poppy plant. You can see they will strike like this on the fruit, so that this whitish latex which turns into yellow, and then it will dry, and then this latex is collected and then dehydrated and it is used uh, as a opium. So it is at present it is grown in India, in Pakistan, Afghanistan, and then in Southeast Asia. We have especially the Golden Triangle, which has the Burma, Thailand, Vietnam, Laos, and Yunnan province in China, which has the poppy opium production. And then there is also cultivation of opium poppies in Sinaloa region of Mexico and in Colombia. So India is one of the few countries that legally grow opium poppy. So legally it is growing, India is growing, and the only country which legally produces opium gum. And then cultivation of opium is illegal and banned in India, except on license obtained from central government, and it is strictly for pharmaceutical industry. Very important. So why India grows poppy plants means it is only for pharmaceutical industries. And then if anybody wants to grow this poppy plants means they have to take a permission from the central government, because cultivation of opium is illegal and banned in India. So the CBN, the Central Bureau of Narcotics, is responsible for overall supervision of and cultivation for medical and scientific purpose of this poppy, and as it is given in the provisions of Narcotic Drugs and Psychotropic Substances, we call it as NDPS Act. So you might have heard this name in newspapers many times. NDPS acts that so and so person was found with ganja, like that. Uh, uh, um, so these are some of the places where it is gone. So in Rajasthan, Madhya Pradesh, Uttar Pradesh. So India produces about 70 to 80% of the opium that is used worldwide by pharma companies to manufacture vital drugs including morphine, codeine, and pethidine. So we will see these two slides and then we'll close. We'll continue in the next class. The next class teacher is waiting, it seems. So these are some of the terminologies. So opium is a Greek word meaning juice. Opium is a Greek word which means juice, which is the exudate from poppy plant. Opiate. Opiate is a natural and a semi-synthetic derivative from the opium. Opiate is a natural and semi-synthetic derivative from the opium. What is opioids? Opioids are synthetic drugs which have morphine-like activity. Opioids are synthetic drugs which have morphine-like activity. Opioid is a natural and semi-synthetic derivatives from the opium. Opium is an exudate from poppy plant. So opium, opiate, and opioids. So, and what are the uses? It is used mostly in therapeutics. Example: morphine, codeine, fentanyl, buprenorphine, and then naloxone. Morphine, codeine, fentanyl, buprenorphine, and then naloxone. So these are the commonly used derivatives in of opium in clinical settings. You can see morphine, it is used as an analgesic. Codeine is used as a cough suppressant. Fentanyl, it is used as an anesthesia. Pentazocine, it is used as an analgesic. Tramadol, it is used as an analgesic. Naloxone, it is used in the treatment of opioid poisoning. Pentazocine, it is also analgesic, already it is there. Buprenorphine, it is a pre-anesthetic medication. Loperamide, it is an antidiarrheal preparation. So these are all the derivatives of opium. So very commonly used in a day-to-day setup. Morphine, codeine, fentanyl, pentazocine, tramadol, naloxone, buprenorphine, loperamide. So we will stop here and we will continue in the next class. Thank you very much.